Mediscore. Here's how we work. We couple your datasets, such as claims information, with our own analytics and physician-led chart review to find gaps in care for your enrollees. Let's take John, for example. After a thorough review done by our own internal physicians, we find that John is most likely suffering from diabetes with peripheral neuropathy and rheumatoid arthritis. Now, because Mediscore utilizes doctors, we're also able to find a condition that has never been diagnosed by any provider ever before. In John's example, our review finds that he likely suffers from morbid obesity as well. But knowing the gaps in John's health is only the first step in his management. Next, Mediscore takes our physician insights and drops the information on the market's first ever patient-specific ECDI, or Electronic Clinical Documentation Improvement Form. Here's an ECDI our team of physicians and coders created just for John. Our next step is to engage John's primary care provider using our own MD provider liaisons who are able to have a peer-to-peer conversation with John's doctor about ways to improve his overall health. We've seen that using medical doctors to engage the primary care physicians gets their buy-in, increasing compliance well beyond the market's best. Next, Mediscore customizes the workflow for each physician's office to decrease the work for the providers and supporting staff. We aim to be as minimally invasive as possible. Once the best process is established, the ECDIs are made available to the provider prior to John's next appointment. This way, next time John makes a visit to his doctor, the ECDI is present in his chart, alerting the provider to the conditions our doctors believe are active but are not being treated or documented for. This process allows for providers to be alerted to gaps in coverage right when John is there, allowing them to address the concerns during this visit. Once completed, the ECDI along with the chart are reviewed. First, by our MD provider liaisons to confirm conditions are being managed and properly documented. And secondly, by our licensed coders to confirm everything is up to CMS standards. Only then are the verified conditions sent over to you. This tried and tested model ensures provider compliance so that patients like John are treated for all the conditions that they're suffering from and that those conditions are being accurately documented. Mediscore. Conditions managed. Reimbursements realized.